What if I told you that the human eye is the most important organ in our body? So powerful that it could possibly help us hack our own brains. And that by mimicking eye movements that occur during REM sleep, you could fix your own brain from being stuck on trauma, an event that overwhelms the brain's ability to cope. The eye, the sensory organ responsible for seeing, also serves as a tool for healing and curing through therapy called eye movement desensitization and reprocessing, or EMDR. No one likes reliving negative emotions and memories, but there is evidence for a proven eye method to overcome them. A cure for trauma is possible when the patient focuses on a distressing image, thought, or memory, as well as any related body sensations or emotions, while concurrently receiving bilateral stimulation. A bit like daydreaming, this kind of therapy escorts you to the past to relive, while grounding you in the present with eye movement or tapping. With this kind of exposure therapy of reprocessing, EMDR has shown to be effective on all types of trauma, from childhood memory of teasing, pandemic anxiety, and even war veterans with post-traumatic stress disorders. According to the U.S. Department of Veteran Affairs National Center for PTSD, the goal of EMDR is to help patients process upsetting memories, thoughts, and feelings related to the trauma they suffered. EMDR, eye movement desensitization and reprocessing, is known as a psychotherapy treatment performed in effort to heal the brain from trauma. It is especially effective for those who struggle to talk about their past experiences. This psychotherapy typically involves a therapist who either has their patient follow lateral eye movements or repetitively tap on oneself while remembering and reliving a traumatic event. Patients of EMDR have shown to benefit from such therapy as they fix their brain to a cognitive shift, clear from trauma disturbance. But what is trauma? Trauma is not a sign of psychological weakness nor a character flaw. It's a brain issue. The issue relates to how the brain processes and responds. Trauma is an indicator that information is stuck in the nervous system and did not have a chance to get processed. Unresolved trauma can lead to other mental health issues like anxiety, depression, drug and alcohol abuse, eating disorders, and suicidal thoughts and attempts. Trauma is merely a biological event that has happened that requires a change in the neurological linkage of the brain, which EMDR claims to do. EMDR does not remove the traumatic memory from the brain, but instead heals the brain to process the memory. The method of EMDR was founded by psychologist Dr. Francine Shapiro. The idea came to Shapiro when she was a psychology student in 1987. She took a walk through Vasona Park in Los Gatos, California. She realized that on her walk, the disturbing thoughts haunting her were disappearing. When she later tried to have the same thoughts again, they no longer had the same effect on her. The negative thoughts no longer bothered her anymore. Surprised by the reaction, Shapiro was curious to find out why. Paying much more attention to her walk, she noticed that when a stressful thought came to mind, her eyes began moving rapidly back and forth until the thought shifted away from her consciousness. When trying to bring up the same thought, it had lost its power over her. In her textbook, Dr. Shapiro explains her findings and how she studied on herself deliberately and noticed the same thing happened. She explained that, quote, "The thoughts disappeared, and when I brought them back to mind, their negative charge was greatly reduced." To understand why EMDR is effective, we need to understand how the brain works. The part of the brain that detects threat and fear is called the amygdala. When you feel threatened or afraid, the amygdala normally responds by releasing stress hormones that prepare the body for either fight, flight, or freeze. But the brain does not always manage and resolve all trauma. At times, distress from disturbing events causes upsetting and overwhelming feelings of being back in that moment or frozen in time. To resolve this, the eye movement therapy rewards through dopamine when moving past the trauma is successful. EMDR helps the brain process and move past the negative memories so that the brain no longer feels as though it's still in danger. Using Dr. Shapiro's experience as an example, walking through the park while having disturbing thoughts can be seen as a forward confrontation. As she physically moved forward through space, she also pushed her thoughts across the threshold to be resolved. Because of inconvenience and lack of controlled space, patients are not going on walks with their therapist, but instead, EMDR is implemented by performing lateral eye movements during sessions to simulate that eye movement that happens when moving forward. Sessions involve the patient bringing an upsetting memory to mind and at the same time tracking the therapist's fingers as she moves them back and forth for 30 seconds. The method of lateralized eye movement, along with recounting traumatic experiences, separates the negative emotions because it quiets the amygdala. This happens when you use your brain's confrontation circuit. In neuroscientist Andrew Huberman's team's research, they found that the brain circuit, not for run, hide, or freeze, but for forward confrontation, was actually rewarding. Utilizing your brain circuit to confront by facing your threat, you suppress activation of the amygdala. In addition, the brain releases dopamine as a reward for the forward effort and leads to healing. When you move forward towards a threat or fear, such as trauma, the brain is taking action to reward and repair. A healed brain with a resolved event will then remember the experience without friction. EMDR changes how certain memories are stored in the brain, then reduces and gets rid of symptoms. According to the American Psychological Association, it's not a one-step process, but an 8-phase approach that includes Phase 1, history taking and treatment planning to determine triggers and goals. Phase 2, preparation to explain the treatment process and practice eye movement. Phase 3, assessment, identifying and targeting the traumatic memory and assessing the effect. Phase 4, desensitizing focus on the traumatic memory, practicing eye movements, then reporting outcome. Phase 5, installation to strengthen preferred reactions to the trauma that EMDR can bring out. Phase 6, body scan by observing one's physical response to their specific trauma and the preferred reaction. Phase 7, closure, where the therapist provides specific instructions and techniques to work on until the next session. Phase 8, reevaluation. This starts the next therapy session to evaluate how the previous therapy session went and how to further improve. How does EMDR differ from something like hypnosis? EMDR is evidence-based, has biological and physical components, and does not put patients into a trance-like state. In over 26 controlled studies, EMDR has shown to be an effective treatment in 75 to 100% of PTSD patients. A study by HMO Kaiser Permanente reported 100% effectiveness in single trauma PTSD victims and 77% in multiple trauma PTSD victims after 6 sessions. Another study showed 77% effectiveness in combat veterans experiencing multiple traumas after 12 sessions. In an article published on behalf of Royal College of Psychiatrists, research has suggested that EMDR is more effective than pharmacological treatment and most other psychotherapies for treating PTSD. In a study published by the Journal of Clinical Psychiatry, the efficacy of EMDR rivaled that of Prozac in patients with a background of extensive childhood abuse. Although success rates of EMDR are highly impressive, many PTSD victims go without treatment because access is a posing barrier. Reasons for lack of access to psychotherapy treatments include high therapy costs, stigma associated with psychological therapy, physical constraints such as living in a sparse population, agoraphobia, poor physical mobility, or lack of access to transportation, healthcare rationing of services, and long waiting lists for psychotherapy. Globally, over 70% of young people and adults with mental illness receive no psychotherapy treatment. These rates of non-treatment are even higher in low-income countries. Consequently, to defeat these barriers of access, global leaders pushed for urgent action towards the development of mobile and digital technologies to increase access to psychological therapies worldwide. Another action towards providing access to psychotherapy such as EMDR is teaching self-administration. Dr. Shapiro even suggests so in her self-help book called Getting Past Yourself. The book details several techniques used in EMDR therapy that readers can employ to deal with disturbing emotions and physical sensations. Increasing awareness and information on self-administration offers communities a higher chance at personal exploration and empowerment by taking psychotherapy into their own hands. Today, we see self-help for EMDR expanding its reach beyond to YouTube videos, online health forums, and mobile apps. By improving access and providing more psychotherapy, it's possible that the world can be healthier mentally. Today, EMDR is recognized and practiced internationally as an empirical treatment by the World Health Organization, U.S. Department of Health, U.S. Department of Defense, International Society for Traumatic Stress Studies, Cochrane, and the UK Department of Health. EMDR therapists claim that through this treatment, trauma events are brought into conscious awareness, returning you to past scenes, helping your brain to liberate that past in effort to rewrite your story. Free from triggers, free from disturbance, free from trauma. Does EMDR sound like something you'd be willing to try? If so, leave a comment down below. Like and subscribe if you haven't already done so, and I'll see you in the next video.